Hi, Laura.
Hello.
My name is Evelyn Ayawi, and I'm going to be interviewing you this afternoon about something that is very, very dear to my heart. I'm a dialysis nurse. I've been a dialysis nurse for a few years, and I realized that, a lot of time our biggest issue is infection. And I know, by working with you, that is something that is very dear to you. So, audience, I will be talking to Laura Willis, and she will introduce herself now.
My name is Laura Willis, and I've worked in dialysis for 8 years, and I currently am a renal nurse navigator and do case management and education in our renal clinic and a chronic dialysis unit. And I also do some work as transplant coordinator.
Okay, thank you. I have a few questions, just for somebody who doesn't know anything about dialysis catheter and the risk. Could you kind of help us elaborate on that?
One of the forms of vascular access, or access to the bloodstream that we use in dialysis patients is called a tunnel dialysis catheter, and that is a central line, and it rests in the tip of your heart, the right atrium, and because it is a central line and rests in your heart, you're at a high risk for infection if you're a dialysis patient who uses this for access. We need to access the catheter at least 3 times a week, and that involves both hooking the patient up to dialysis and taking them off of dialysis. So there's several opportunities there for germs to be introduced into the system, and it leads to a high risk of infection. Most patients who have a catheter will end up with at least 1 infection a year.
Okay, thank you. On an average, how long does a patient have a catheter on?
We want our patients to not have catheters at all, if possible. So in renal clinic, we do a lot of education, encouraging patients to have vascular accesses such as fistulas or grafts placed in their arms before they ever start on dialysis. So we prevent infections, potential infections, by not providing the opportunity to have a catheter.
Okay.
But unfortunately, things don't always work out. Some people start on dialysis emergently. Other people try to get a fistula or graft and they have problems, or it's not ready at the time they have to initiate dialysis.
Okay.
So they start with a catheter. We have found that once a patient has a catheter, it's very difficult to get the catheter out. Many patients become pretty attached to them. They don't like the idea of having to be stuck with needles, which is what they would have to do if they have a fistula or graft.
Okay.
And also it becomes really problematic getting them scheduled to have the access surgery for a fistula and a graft while they're on dialysis, because they're at dialysis 3 times a week for usually 5 hours each time, and then there's travel time to and from. It becomes difficult to schedule other appointments.
Okay.
So many patients, unfortunately, will keep that catheter a year or even longer.
Okay. So, who are the people that will access these catheters, and what kind of training do they have to prevent infection?
It varies state to state and facility to facility as to what policy is. In our unit, the catheter can be accessed by registered nurses or hemodialysis technicians. Most facilities, all facilities that accept Medicare, require their dialysis technicians to be certified, and part of that training would include infection control.
Okay.
And then, of course, all nurses in their nurses training learn infection control techniques for central lines and catheters.
Okay. So, does it vary year to year? How often they go through this training again, you know, like an in-services or something like that? Do you guys do that? Just,
We do routine in-services, on hand washing and catheter care.
okay.
Our facility for all nurses, not just in dialysis, also has an annual requirement for catheter care infection control education module.
Okay. You know, sometimes when I walk through the unit, you see some of the nurses or techs using sterile gloves. And in some instances, they are not using sterile gloves. I'm just wondering, what is the difference as far as infection control goes?
Well, obviously, sterile gloves are better to use than regular gloves, but it's not a sterile procedure.
Okay.
But it's our policy and procedure that we use sterile gloves when we're accessing a catheter.
Okay. So I was wondering, does the caps has anything to do with it? You know, because some units uses the Tego caps and some don't.
It varies unit to unit. What their policy is, we use something called a Tego cap,
Okay.
which we leave on. We put it on once a week. We change it once a week, and we leave that on until the next week. Of course, we have a special cleaning procedure before we access that catheter
Okay.
and that cap.
All right. You know, just generally, will you say that the amount of infections that you find in these catheters, are they getting better or worse?
We have a lot of catheters in our unit, so we have over 30% of our patients use a catheter, which is very high, too high, and we have a large unit. We have a capacity for 72 patients.
Okay.
So in 2013, fiscal year 2013, we had 13 catheter infections,
Okay.
and we identified that we had a problem. In 2014, we had 9, so we had a slight decrease, but we implemented several different things, and so far in 2015, fiscal year 2015, so we're 6 months in, we've had 1 catheter infection.
Wonderful. Thank you very much, Laura. Appreciate it.